Hello to all our quality-minded listeners and a special shout out to our Mayo Clinic Care Network members. Welcome to Key into Quality, a Mayo Clinic podcast that focuses on healthcare quality, experience, and affordability trends and solutions. Today, we're continuing our conversations about staff safety, and we're going to talk about what I call preserving the fighting strength of our staff. Thanks a lot for joining us. I'm Dr. Tim Morgenthaler, a professor of medicine here at Mayo Clinic and a vice chair for Mayo Clinic Quality. Co-hosting with me today is Sherry. Sherry?
Welcome, everyone. I'm Sherry Nemec, Consultation Relationship Manager for Quality at Mayo Clinic. Yeah, I like how you phrased that, preserving the fighting strength of our staff.
Yeah,
I
I have
totally
to,
think this topic fits that.
I'm stealing from my days in the U.S. Navy. So you may not know this, but before I came to Mayo Clinic, I served as a medical officer in the United States Navy, and that means we took care of not only Navy personnel but also the Marine Corps. And so it was explained to us, made very clear that our job in the Navy Medical Corps was to preserve the fighting strength, and that meant making sure that our fighting members were fit and healthy and ready to go at all times. And it just occurred to me as I was thinking about today's conversation that in healthcare, we're in a battle to keep our healthcare personnel safe and continuously improving so that we can really provide the kind of care that we want to provide. And today we're going to be focusing on preventing some of the physical wear and tear on our staff so that they can bring their best to work. We've been in some of our prior podcasts talking about burnout and resilience.
That's right.
Well, physical is important, and we really have a problem here. So, for example, did you know that the annual prevalence of significant back pain amongst our nursing colleagues across the nation ranges from anywhere from 43 to 47%? And, that's
I did
prevalence.
not.
And upper extremity injuries are very common in technologists like ultrasound technologists and radiology techs that are getting ready to scan you, and our lab workers even that are doing these repetitive tasks. I have a lot of surgical colleagues, and I know that they have very high rates of cervical spine and lower back injuries that when they go out, the whole OR doesn't work anymore. So these are
Right.
really important issues. They not only impact the well-being of our healthcare workers, but they're a huge burden on the healthcare system themselves when these people are unable to work and perform properly. And staff turnaround makes it very hard, as we've been talking over the various podcasts here, to build a strong culture, and they lead to pinches that can really threaten the best care. So we're in a time where we need more out of less all the time, right, Sherry?
Right.
Yeah. And
The challenge.
how are we going to do this? How are we going to do this? So it turns out that there's a science behind this. Ergonomics, or human factors engineering, really can offer some promising solutions. And I had to look up a definition for this because I had a vague idea, but as defined by the International Ergonomics Association, ergonomics is the scientific discipline concerned with optimizing human well-being and system performance. And recent studies have shown that ergonomically designed equipment and intervention can really reduce workloads, body discomfort, and actually promote a lot greater productivity mentally and emotionally and so forth as well. So anyway, I'm giving you the summary, but we've got an expert with us today. Joining us today, our expert is Nick Smith, who is an ergonomist in the quality department at Mayo Clinic. Nick, welcome.
Thank you so much for having me. That really fired me up right there, Dr. Morgenthaler. I'm really excited to be here.
Well, you're part of our Preserving the Fighting Strength. So tell us a little bit about yourself and how did you get to Mayo Clinic and what on earth does it mean to be an ergonomist?
Yeah, absolutely. I've been working here at the Mayo Clinic for about 4 years now, so still pretty new. I come from an industrial engineering background, and I'll kind of talk a little bit about how my profession in ergonomics, we come from all walks of life, but I in particular come from that engineering background and really have more of a history in manufacturing environments. But when I was looking for a career in late 2020, Mayo Clinic was looking for an ergonomist, and I thought that would be extremely exciting. Obviously, the healthcare industry is vastly different than a manufacturing environment in terms of the variety of work, the difficulties. You mentioned a lot of the strains and sprains that our workforce is subjected to. And so it's an extremely compelling situation. And, I got into ergonomics really for that, as kind of the wholesome, humanistic side of just helping people not be in agony. That's really why I focused on this industry. And there's really no better place than a healthcare organization where I firmly believe in the mission itself, and I like my role in it and, helping our workforce help the patients.
Nick, when you and I were chatting the other day, you were mentioning that there's some misunderstandings about this work in a healthcare setting. Can you tell us about a few of those?
Well, I think that ergonomics is a pretty new profession or field, and it really became in the general population's forefront in the tech industry boom of the late 1990s and computers and how those were really spawning a lot of ergonomic injuries of carpal tunnel syndrome. And it was just so prevalent that I think that when most people hear that word, that's where they initially go to. They think
Hmm.
about fancy mice or chairs or keyboard. And that is definitely a large extent of the profession. But for myself, and I think folks who work for, large companies, that's actually a minority of the role. I do about maybe 15% of my work is dedicated to kind of computer workstations. So I guess in my opinion, the misunderstanding is that this really applies to almost every profession out there. And for healthcare organization, you mentioned nurses and sonographers and surgeons. We also have our environmental services with our housekeeping group and our power plant employees. They are all doing very physically intensive tasks in different regards, whether it's different postures or lifting heavy stuff. So it really just affects a ton of different people that maybe one might not initially think about when you think about ergonomics. So I think that's kind of the main misunderstanding or just lack of general awareness for the general population.
Nick, your particular job falls ultimately under quality and safety. And I just wonder your thoughts about that. And actually, as I was thinking about asking that, I just remembered you actually, I think for a number of years, have been on the Enterprise Patient Fall Prevention Committee. So maybe you can just kind of put all those things together and tell us a little bit about your role in quality.
Yeah, I think it's a really important fit to be under quality. As I said, ergonomists come from a lot of different walks. I come from an engineering, but a lot of physical therapists get into ergonomics. A lot of even psychologists get into the kind of human factors element of it, kinesiologists. So there's a lot of folks coming into the industry with their own perspectives. And I think that being within quality, where there's this established culture of the DMAIC process and classic kind of buzzwords about like lean waste and those things. I just think that those really help champion the role. And, you mentioned the definition at the start of the show and how, yes, there is the human component. And I work with individuals every day, one on one. What I find to be the most effective approach of ergonomics is the systematic perspective, where you're understanding all the complications that, yes, maybe one employee was having a backache, but it is just so much bigger than that. There are so many more whys to how that came to be. And so I just think that the quality, again, that culture instills that idea of think about the whole spectrum, the whole system, and where this could affect many different folks.
At Mayo, you've come in and you're in quality, and that's because staff safety is actually in quality and so forth. We have listeners from all over the globe. Maybe in other healthcare organizations, where do ergonomists end up working and living, or are they that common even?
It's definitely not common, unfortunately. It is a small niche role where really, even today, some of the smaller clinics may be able to do a little external consulting and have somebody come in part-time. But even if there is a full-time established specialist, they're oftentimes tucked into human resources, which really is not a bad fit per se. I mean, there's a lot of relationship that I have with HR in terms of return to work and hiring people based on physical demands for the jobs and things like that. But I think that the scope that quality again provides and that just emphasis on systematic improvement is really a better fit. So most folks are kind of tucked into HR from what I've seen in the industry.
Nick, you've been involved with many departments across Mayo Clinic in this work. Do you have some examples you can share about how your work has impacted either decisions made at the organizational level or maybe at the individual employee level?
Yeah, well, I can start small. I did mention that and Dr. Morgenthaler, you did as well. Mayo Clinic is absolutely not perfect in preventing ergonomic injuries. We have our fair share of folks getting hurt out there. And so I do work one-on-one with individuals. And sometimes the solutions that I try to come up with are individualistic. They're for the person
Sure.
themselves. And unfortunately, there's really not a systematic approach there. Either they're an extremely tall individual or they have a certain injury history that I have to kind of account for and come up with some unique solutions for them that maybe for the rest of the department would not work. So yes, I work with individuals pretty routinely. I can think about, I worked with an ultrasound sonographer recently who was dealing with some wrist discomfort, which is not abnormal for sonographers. Coming into the Mayo Clinic, I was ignorant really towards the physical demands that a lot of our staff have, but
Yeah.
particularly with ultrasound sonography, my only personal exposure had been my wife and I having a baby ultrasound, and it was just all bells and whistles and fireworks and fantastic, and not
You were
for one
looking at the
sec.
screen, not at the hands.
Exactly.
I know where you were looking.
And I oftentimes see ergonomics in my just general walk of life. I can't help it, just being in the professional. If you're watching like a Hollywood movie, things kind of call at you. But in that instance, you're right. I was so preoccupied by the magic that was happening that honestly, not for once did I really think about, wow, this employee is actually pressing very hard on this very difficult to grip probe and really in an awkward posture. So it's kind of all the three components of poor ergonomics, really. So I worked with an individual here in the last few years who was having some wrist discomfort and talked through about, what are some of the more problematic procedures that you find more common and problematic. And then I worked through and we really just kind of played around with a sonography bed and said, hey, what if we move the patient bed in this way and position it in this function? Or maybe we can hold the probe in a different way. And that seemed to really help for those procedures. It definitely is not an approach that would fix all the problems. You can put a patient in the most optimal way, and if you're going to be pushing down on them with 50 pounds, you're going to unfortunately get hurt. That doesn't help in every situation, but it did seem to really help with this individual. But again, I really do try to target the more systematic improvements with the clinic. And one thing that my group and staff safety have really done a great job of improving in the last few years is working on new construction and renovations with our facilities project services. So we work hand in hand with our architects and review blueprint schematics and try to look for difficulties before our staff are exposed to those kind of frustrations. And that's not easy to do, to be quite honest. It's not really easy to look at a blueprint and envision an individual having discomfort. But there are some kind of common things that spring up from time to time, like high reaches, high shelving, tight, cramped quarters where somebody might be forced into an awkward posture. There's things like work surface heights and the kind of furniture that they're going to put into these areas. So we try to do our best and really learn, unfortunately, from poor designs of years past and put those into our building design guidelines so that we're just constantly getting as good of an interaction with our human staff and the kind of systems around them. So that would be kind of my systems approach. That's just not myself, obviously, again, with that staff safety. So they're looking at sharps incidents and things like that can be prevented as well.
So I gather from what you said that we might be a little bit ahead of the curve in terms of, involving ergonomists right in our workspace design. And I know I've seen the results that you have brought to individuals in terms of, let's just say, remediation of problems. What do you think are the growing trends around ergonomics in healthcare settings? Should we all be looking for more of this? And what are your thoughts about that?
Yeah, well, to your point about Mayo Clinic's maturity, I would absolutely agree. Even though we have a lot of injuries taking place, there is a maturity in terms of folks are very aware of ergonomics here. From the get-go, there is ergonomics training for our staff. It is a very prevalent discussion in our team meetings. Championing improvement plans from our frontline staff is extremely common. So I find our maturity to be extremely high. And I think that the growth of ergonomics is really becoming kind of a trickle down effect that even those clinics or other manufacturing industries or what have you, those smaller companies, they are also reaping a lot of the rewards of ergonomics, even if they don't have an ergonomic specialist. And that's just because of the kind of cultural prevalence. Again, if you go to watch any sort of modern Hollywood movie, there are many times you'll see something that's not spoken out in plain lettering. This is about ergonomics, but it's just kind of baked into it. You'll see lifting devices. You'll see interesting kind of computer workstations in movies and TV shows. So there's just a much larger general awareness, and people are bringing that to their work setting. They're saying, why don't we have such and such? Or, hey, this looks like it's going to cause a problem down the line. So I think that those smaller industries are still benefiting from this push in society for better ergonomics.
So, beyond what you mentioned there about just generating more awareness, do you have any advice that you could give other organizations that are really interested in maybe going to the next step or more proactive strategies around ergonomics in their site? What are your
Well,
thoughts?
yes, and I would say for an industry that's starting to look into ergonomics, it is extremely hard to start with being proactive. There are oftentimes many fires that need to be put out to start with, and there is a lot of reactivity. But I do think there's definitely some ways to encourage proactivity from the very jump. And I think that things like working little small success stories into your team meetings or morning huddles can really encourage staff. And to be frank, I know that OSHA maybe gets a bad rep in some certain industries, but they actually provide a ton of fantastic free ergonomics research and literature. And I use those words, those are exaggerated words, really bite-size success stories and things that you can take to your team huddles and just say, hey, just want to talk through this. And it really exposes a lot of different aspects about ergonomics. So I think it starts with that. We want to encourage looking for these things and do stuff about it. And then as you do get some smaller opportunities or low-hanging fruit, it's just really important to build off of that momentum and champion those successes. And then ultimately that leads to long-term success. So again, it's hard at the very start to say, hey, let's start baking these things into our new design guidelines when you're still responding to folks getting hurt on a regular basis. But ultimately, it does get there rather quickly if you just kind of educate your staff from the get-go and really appreciate their involvement.
Well, Nick, you've brought us a lot to think about. I'm just wondering, what would you like to leave our listeners with in terms of closing thoughts or messages or a summary?
Well, one thing that kind of keeps me going is that, I work in the quality department for those kind of quality buzzwords about like production and throughput and rework and those things that can really cost the clinic a lot of time. Like you said, Dr. Morgenthaler, what happens when one of our surgeons has to take time away from work? We might not be able to execute even certain procedures for some time. I mean, there are some dire consequences. What happens when one of our pivotal environmental service housekeepers has to take off time for work? It's the same situation. It really has a snowball effect. In my opinion, there's no blame on the employee at all. It's really a sense that our system has been from preventing them from getting hurt. And that's just what kind of keeps me motivated to understand all of the fallout that these issues have. Somebody who's dealing with discomfort or injury, they take that home. That affects their lifestyle afterwards and throughout the day. So I find it to be extremely motivating to prevent that, not just from kind of a bottom line and expense situation, but just from a humanitarian perspective. And I hope that folks who are listening can kind of instill that in their own day-to-day and in their work.
Thanks, Nick.
Wow, Nick, just can't express enough gratitude for passion with us and those
Absolutely.
and
Yeah.
our leaders. I mean, you really motivate us. You got us pumped up. And in particular, thank you for the work that you're doing for our staff at Mayo Clinic. Really first rate and great stuff. But we have come to the end of our podcast. We're really glad our listeners could join us, and we're glad that you would join us, Nick. And we hope that the information provided has been insightful and valuable. Again, Mayo Clinic's Key into Quality podcast aims to highlight some first steps in addressing important quality challenges in your organization. Our goal is to improve quality for patients and the populations that we all serve. If you enjoyed this podcast, we'd be grateful if you leave us a review on Apple Podcasts, a rating on Spotify, or feedback wherever it is that you are listening to us. You can follow us on your favorite podcast platform. Also, please let others in your organization know about the podcast so our information can be spread. Until next time, goodbye.